Good evening. This is Congressman Brad Sherman. Welcome to our 6th bi-weekly San Fernando Valley Telephone Town Hall. People will be joining us for the next couple of minutes, so I may repeat a couple of things so that everyone has a chance to hear. This has been a terrible week for America, arguably the toughest week we've had this century. America suffers from the pandemic, the economic shutdown, and now the murder of George Floyd has once again shown us what we already knew, and that is that we are beset by systemic racism that has caused people of color, particularly African Americans, to be killed and sometimes just mistreated again and again and again in their lives. We cannot possibly cover these topics adequately in the next hour, but that's what our technology provides us on this particular evening. We will have another telephone town hall on June 16th at 7 p.m. And we may have a town hall earlier than that as well. Now, if you get cut off, and you'll want to jot down this number both for today and for our next town hall, the dial-in number is 877-229-8493. And then the PIN number is 13402. So if you get disconnected, dial in 877-229-8493, dial PIN number 13402. Now, if you can just sit back and listen, but if you have a comment or a question and want to get in queue to raise those points, dial *3 on your keypad. That's *3 to make a comment. I am confident that America will overcome the challenges we face, that we will repair our economy, that we will deal with the pandemic, and that if we do not heal in the next year or two our racial divisions, that at least we can move in the right direction. We'll be joined by Councilman David Ryu, who represents Sherman Oaks, Toluca Lake, Van Nuys, and areas on the other side of the hill on the Los Angeles City Council. We'll also be joined by Dr. Lynn Goldman, who has been on 2 of our previous 5 telephone town halls and is backed by popular demand because of the medical expertise that she brings. I'm going to keep my opening comments very short, but I do need to say that obviously George Floyd was murdered, and it was there on video for all of us to see. It is a gut-wrenching video to watch every time I see it. Donald Trump was absolutely wrong to evict peaceful protesters using active duty U.S. military personnel simply because he wanted to take a photo op at a church. It is wrong for the president to talk about sending troops not requested by a governor. That's moving us in the wrong direction. And it's wrong for the president to divide America in the hope that he can eke out some sort of political advantage. And of course, it's been wrong since the 1600s for us as a nation and as a people to deal with institutionalized racism. And at the same time, it is wrong to dishonor the memory of George Floyd and the efforts to heal our society by engaging in vandalism or violence. So we have so many topics to deal with. They'll range from the details of how to deal with the PPP program or the unemployment program relevant to the COVID crisis to the gut-wrenching scenes that we've seen involving demonstrators, and before that, of course, involving George Floyd and so many others who were killed before him. But we, of course, need to focus on the coronavirus and how we're going to deal with it, how we keep ourselves safe, what the right reaction is. And we're learning about it all the time. Very few people, if any, know more about the coronavirus than Dr. Lynn Goldman. She is the Milken Institute School of Public Health dean, I believe, and is a member of the National Academy of Medicine. She's an advisor to both the CDC and the FDA. And Dr. Goldman, I wonder if you could give us your insights into the coronavirus and what we can do to keep safe. Hello? Hello?
Yes, thank you very much, Congressman. This has been quite a week for those of us in public health. Last week marked the 100,000th death from coronavirus in the United States, and which is a terrible milestone to have reached. And also, we must remember it was the week when the president decided to take us out of the World Health Organization, which is a very important part of coordinating the fight against such a major global pandemic. And then, of course, we saw the pandemic of racism that raised its ugly head, and that in of itself is a major public health hazard. When it comes to the coronavirus, in most of the country, things have been moving in the right direction in terms of the transmission of the virus slowing down. Our efforts to stay at home, our efforts to wear a mask, to practice good hygiene with washing our hands, washing high contact surfaces, social distancing 6 feet between people, all of these things have been making a positive impact on the epidemic in the places where people are doing them. And of course, in California, this has been effective, even though I know that Los Angeles has been moving along a little more slowly than some of the other parts of the country. It was pointed out that 3 cities, Los Angeles, Chicago, and Washington, D.C., have been less tractable than other parts of the country, probably because of how diverse these cities are, that they're major hubs for travel, and it's just harder to therefore control the epidemic, but we're making progress in those places as well. I personally have been quite concerned as an epidemiologist with the fact that the horrible episode with Mr. George Floyd, which has caused peaceful demonstrations across the country, and as you point out, even some outbreaks of violence and rioting, that has brought people together at a time when we need to see them distancing. And every time I see the video of people out there demonstrating, I'm just hoping that they're wearing their masks, that they're social distancing, that they're doing what they can to protect themselves from the coronavirus, because it is still moving among us. We've had some glimmers of hope with treatment. The drug remdesivir, yet another study came out about it, that it seemed to have some effect in reducing the amount of time that people are ill when they have the disease. And it's seeming that some people are responding well to immune globulins from people who have recovered from COVID-19. And in fact, people are now giving blood donations if they've recovered from the disease in hopes of being able to confer immunity to other people who are ill. And we have heard some news about some vaccines that are under development, and even optimism by Tony Fauci that some of those vaccines may make it on the market by sometime early in 2021. I don't want to be optimistic about that, but at the same time, I want to be hopeful, because I think that a vaccine is what we really need the most of all. But mostly, I think that this has been on the shoulders of people, ordinary people, who have stayed at home when asked to stay at home, who, when leaving home, are following the instructions to have social distancing, wear a mask, to protect each other, not just to protect ourselves, but to protect each other and to protect our communities. And it's been very inspiring to me to see that.
And people have come together in the San Fernando Valley, people working toward peace, people cleaning up from vandalism during the day or safeguarding stores at night. And at the same time, people are helping the community every day that they wear a mask or stay home, because wearing that mask may protect you to some degree, but its greatest impact is to protect others from the disease you may be carrying, and you may not know that you're carrying since you are contagious before you're symptomatic. I do want to go over the statistics. We seem to have plateaued in this country as far as the number of cases and the number of deaths. It's running about 20,000 new cases and about 1,000 deaths every day. This idea that you reach a peak and then it quickly goes down, unfortunately, has not been the case. It has declined in the United States. Most of that decline is because of success in the New York City area, which was hit by this disease the worst, and it is now bringing down its disease level and its death level. In Los Angeles County, it's plateaued between 1,000 and 2,000 new cases every day and 25 to 50 deaths every day. We do not have death statistics for the San Fernando Valley, but the new cases are running at 100 to 200 new cases a day. So we're all anxious to go back to our lives the way we wanted, but the fact is this disease has not gone away. Finally, as to testing, we are now up to over 400,000 tests a day. That is closing in on half the number of tests we might need, along with a contact tracing program. And Dr. Goldman, you may have a different number in mind, to really help us open up. What's an interesting statistic is that a month ago, every single day, it seemed like 19.5%, give or take only a tenth of a point, were positive. That has gone down almost continuously every day. And so today, 10.25% of those tested were positive. So as you're doing more tests, you're testing people who are not symptomatic, and therefore you're getting fewer positives. Doctor, people are concerned about how to avoid getting this disease, and a month ago we saw two methods of transmission. One was through the air, some little spit or particle coming from somebody's mouth and hanging in the air, and the other was by touching things that had been touched by others. It seems that this disease is not transmitted that much on surfaces and is much more through the air. Is that what you see, and have there been some new studies on that?
There have been new studies, and there's more and more evidence accumulating that a lot of the cases are coming about through the air and through actually the production of droplets, not just by coughing, but also by speaking, by singing, vocalizing. And so, which is why people without symptoms can spread it. By definition, if you have a cough, you have a symptom. But if you can be spreading it from singing, if you can be spreading it from talking, and that's well documented, then you could be spreading it either before you have symptoms or without any symptoms at all. And in fact, the best studies are now showing something like 45% of cases are coming from people who do not have symptoms. We still are concerned, though, about what I would call high-touch surfaces, the surfaces that a lot of people touch in the course of the day. And what I mean by that is surfaces like doorknobs and elevator buttons and that kind of surface. And those need to be cleaned more frequently. If you're also at a table and a cafe, as cafes are opening up, people tend to touch those. So you want to see those kinds of surfaces being wiped down between use, but that's a little different than saying then you have to go under the bottom of the table and clean all of the legs and every single bit of it. You really need to be concerned about the places that people are touching frequently and where you might touch them. The other thing that's interesting, how you get the virus from touching things is you touch a surface someone else touched, you pick up the virus on your hand, and then you touch your nose or some other area on your face. But if you're wearing a mask, you're protecting yourself from that. And that's another benefit of wearing a mask.
And if you wear a mask, if you've touched something and you wash your hands well before you've touched your face, you've protected yourself from the virus. So wearing that mask just delays the time when you're touching. I think they've done studies about how many times people touch their nose or their face, and it turns out to be a lot, but it's a lot less if you're wearing a mask. I want to urge people to dial *3 if you have a question or a comment. That's *3. Doctor, what else can you tell us about this disease? Or we're used to a flu or influenza epidemic every year that kills, as I remember, very roughly about 1 out of every 1,000 people who get it. And of course, the people who die are those who are old or have pre-existing conditions for the most part, but even a healthy young person can die of influenza and the complications. This disease, the last I saw, instead of it being 1 out of 1,000 who get it die, it's 1 out of 100. Do we see treatments coming down the pike that can reduce the mortality of this disease, reduce the amount of fear that we have to realistically put on the possibility of getting it?
Right now, the most promising treatment for reducing mortality is immune globulin, and at the same time, it has to be given in a way that's very, very specific. People who have had the disease are still making what's called antibodies, immunoglobulins. They can give a blood donation. You can take the immunoglobulins and give them to another person who is ill. However, that only works well early on in the course of the disease, and it only works well in the hands of very, very expert acute care physicians, because if it's the wrong circumstances, if it's too far down the pike in terms of disease progression, the immunoglobulins can actually make things worse. However, if given early, they actually can, it's been demonstrated, improve outcomes considerably, including preventing death. There's other things that we've learned that have been very humbling. One has been that for elderly people who become very severely ill, that we're seeing evidence that being put on a ventilator isn't helping very many of them. And that's very sad, because that's one of the hopes that we had, that if someone becomes extremely ill, if we can treat them, support them through a time where their lungs can heal on a ventilator, we can get them off the ventilator and they'll be fine. But for people who are older, and by this I mean 70s and 80s, the outcomes for those in New York who were on ventilators, many of them have not been good. We've also seen some interesting things, Congressman, about the way this disease is manifesting itself at both ends of the age spectrum, that some of the newer literature is saying that many elderly people initially, when they have the disease, have symptoms that are not typical at all, may just seem to be having lapses of memory, feeling tired, just not feeling good, feeling achy, not necessarily initially presenting with a fever and cough, which is telling us that we need to kind of raise our index of suspicion, as we call it in medicine, that an elderly person with those kinds of symptoms could have COVID-19. And on the other side, the children we're documenting this multi-system inflammatory syndrome that's really quite a severe illness. Rarely occurs in children, but now is definitely due to the COVID-19. It's yet another manifestation of this virus, and it's not only life-threatening, but also can cause a damage to the children's cardiovascular systems that's quite serious. So,
Doctor, we've got a question from the audience, and it may be a question for you. Don, who's why don't we put on our first questioner?
Ann.
Hello, Ann. What town do you live in, and what question do you have?
Hi, I'm in Sherman Oaks, and my question is, if my husband and I have been staying home and avoiding contact with other people since the city said stay home, and the instructions were clean your counters and disinfect every day, the things that you touch frequently. If we have days that we don't even go out of our house, do we still need to disinfect the light switches, the kitchen counters, the sink faucets, all of those things?
I would answer that question, no, you do not. If it's only the two of you in the home and you have been isolating there for this amount of time, I do not think you need to do that. It is a possibility, of course, that one of you, in going out to get groceries or for some other essential errand, that you could pick up the virus. If you have any sense that you do have it, then you might want to go back to that kind of practice or even isolate yourself from the other member of your household, but you probably don't need to do that every day.
And of course, you need to wash your hands as soon as you get home.
Right, and we...
Hello? Hello?
I think we may have lost her.
Ann, we may have lost you. I hope we've answered your question. We're now going to go on to a survey question so that everybody can give their opinion. And we've got a mixture of survey questions, some dealing with Black Lives Matter and the issues raised by the death and murder of George Floyd. We've got others that deal with the practical aspects of dealing with our economic situation. This is question A. The question is, did you receive your stimulus check? That's usually $1,200 per adult, $500 per children. And was it in the amount that you thought was correct? So, and I should point out, if you're single and your income is over $99,000, or you're married and your joint income is over $198,000, you're not entitled to a stimulus check. And if you're close to that, it's phased out, and it's less than the $1,200, $500 that I mentioned. So again, did you receive your stimulus check? Press 1 if yes, and you think you got the right amount. Press 2 if you did receive it, but you're not sure it's the correct amount. And press 3 if you believe, if you have not received anything at all, but believe that you're entitled to it.